Hi, this is Nakeeya. I'm a physical therapist here at Breakthrough. Today I'm going to give you some information regarding flat feet. Most people have heard of flat feet or have flat feet, but they're not really sure how to address that or the impacts it can have on your body in the future years to come. There are two types of flat feet, structural flat feet and postural flat feet. In structural flat feet, it's usually caused by an anatomical imbalance or an anatomical disorder because of which the foot flattens out. The other type is a postural flat foot. And let's take a closer look at the model to get a better understanding of this. This is what a normal foot looks like, having a little bit of an arch here. When you step up on your foot, usually there is weight through the front of your foot and the outer side of your foot here, while there is a gap on the medial or the inner arch of your foot. With flat feet, what happens is this arch collapses, so it kind of goes down this way. So if you look at a footprint of a person with flat feet, you will notice a full foot on the floor, as opposed to a normal footprint where you only see the toes and the outer side of the foot. So postural flat feet are usually caused by weakness of the arch muscles, which causes the arch to collapse, or because of some kind of prior injury in your foot or higher up the chain that makes you change your weight distribution or put more weight on the inside of your foot to compensate for the pain you're experiencing. One of the most common effects of flat feet is plantar fasciitis. If you want more information regarding plantar fasciitis, feel free to click on the link below to get more information on how to address that. Besides plantar fasciitis, the flat feet can also impact the rest of your body, so higher up the chain. Let's look at the model to get a little bit better understanding of that. Anatomically, this does not look like a real foot, but this serves the purpose for demonstration purposes. So if you look at this foot, when you step on it, you're supposed to have a nice arch right here. If you have flat feet, this arch collapses down, causing flat feet. When this happens, it can put a lot of stress on the heel bone here, contributing to plantar fasciitis. Another effect it can have higher up towards the knee is stress on the inner side or the medial knee. What happens is as the arch collapses down, there is a lot more pressure on the inside of your knee because it needs to compensate for the stresses that are in the foot. The third effect it can have is higher up the chain towards your hip. There needs to be a lot of rotational forces to compensate for that increase in weight on the inner side of your arch, which can in turn lead to hip pain or low back pain. So if you have flat feet or know anyone who has flat feet, your first step is to get arch supports. We can take a closer look as to how the arch supports can help your feet and help you higher up the chain. All right, so again, if you have flat feet, your arch is collapsed down here, can cause problems higher up the chain. If you use an arch support just like this, which is usually a shoe insert that you can get over the counter as well, it just supports that inner side of your arch, so it doesn't let it collapse as much. Once that is well supported, it forces the weight more to the outside of your foot and helps the weight distribution down the chain a lot better. In addition to this, you can also work on strengthening the intrinsic muscles of your foot. To do this, you need a towel. Now I'll demonstrate how you're going to do this. So you can start in a seated position. Place the towel on the floor. Probably want to scrunch it up a little bit just so there are some folds in it. You place your foot on there and you're trying to grip the towel with your toes and pick it up. So as you're trying to do this, you're working on the intrinsic muscles of your feet to help support that medial arch and prevent the foot from becoming flat. You can perform this exercise for about a minute or 2 minutes, just based on how fatigued you feel in the arch of your foot. This will just help increase the strength of the arch muscles and help support it a little bit better. I hope this video was helpful. If you need more information regarding this, make sure to get in touch with your physical therapist.